Thank you.
The question again refers to the bill, which we've been through. I didn't vote for. It's not going to be the final bill. However, I'll talk about the bill and then the general idea of what I think is a good outcome if we do health care reform for people like your mother. Under the bill, and I know we're going to have some response on this, but under the bill, there is no rationing. There is no death panel. There is no group of people that meets to determine the productiveness of any individual in society and whether or not we should continue to care. We, as a nation, have had this discussion about end-of-life care, okay, which I think is what your question is, which I will get to. But with the idea of rationing and making medical decisions based on cost rather than the individual, a couple of things. One is, to some degree, that already happens. But more importantly, in the future, under this bill and under health care reform, that is certainly not where I want to go. It's not, I think, where anybody wants to go. I mean, they're like, I voted against the bill. Yeah, voted against the bill. I'll get to the cost of the bill in a minute. So, I don't agree that that's what's going to happen. And we're talking about private doctors and private hospitals. And right now, they haggle every day with the insurance company about a claim that's been denied or whether or not a procedure can order for people that are 75 or people that are 7. That happens every day in America. I bet you half the people in this room have had the experience of spending an hour on the phone arguing with a claims adjuster. That already happens, and it shouldn't happen with a government bureaucrat. It shouldn't happen with a private insurance bureaucrat. It does happen. If this bill moves in that direction, that's not a good thing. It's not something I would support. With regard to the end-of-life care, and I'll summarize it briefly, and if you want me to go into more detail, I will. Right now in America, every day, right now, probably 1,000 times across this country, families somewhere sitting around the dinner table talking about what their options are for advance directives, for do not resuscitate, for end-of-life care. And every day in America, somebody's diagnosed with Alzheimer's, hundreds of people, that will say, you know what, I would like to really think this through and know what my options are while I still can. I want to talk to somebody who's a professional in this. Those discussions happen every day. Advanced directives, end-of-life care, do not resuscitate, and power of attorney, all of that stuff. That happens every day. And what this bill says is, and this has been in previous bills in a bipartisan way. It was in the prescription drug bill in 2003 that passed with all Republican support.
That was a bad bill.
That said, that's a reimbursable expense under Medicare. That's all it says. If you're going to seek that kind of counseling, the counselor can be reimbursed under Medicare. That's what it says. Now, you may or may not think that's good public policy, and we can discuss whether you think it's a good policy, but the point is, that's a long way from a death panel. That's a long way from somebody making a decision. So that's what's in the bill. I suspect that that provision is going to be removed from the bill in the end. So whether you like it or not, this debate, this issue has taken hold. There's a lot of what I perceive to be misinformation out there, but regardless, it's taken hold, and I think that provision might not survive because of that. Did I call out the next name? Do we have somebody? Yes, somebody in the back, tell me if we have a name. No? Okay, no. Carolyn Pettit. Carolyn Pettit.